What's happening? We not getting much exercise. We don't moving enough. But will this document, this plan, this global plan, change everything?
Yeah, we're not moving because one, it's the mindset now, the problem, behavioral. People really are not moving because of they don't understand the problems also related to inactivity. But the other problem is the environment is also not supportive. I think these two things should at least change. If we can change the mindset of the people, and if the awareness increases, and if people start to understand that this is one of the risk factors is lack of activity, because if they are not active, they will be exposed to non-communicable diseases. And if they can do their best to be as active as possible, that they would be healthy, that would be very important. But in order to encourage that healthy behavior, we need to build good environments too. Something that helps people to really move, especially in our cities, that encourages.
But why now? Why is it so important now to begin this movement?
I can say it's as the saying goes, late than never. We're actually late. NCDs, non-communicable diseases, are on the increase now, and their non-communicable diseases are 71% cause of deaths happening now. And it's already a crisis level. And as I have said already, one of the risk factors is lack of activity. Of course, there are other factors like smoking, diet issues, and others. But lack of activity is one of them.
Most concerning problem.
Exactly. So we're reaching crisis level now, and we have to change the tide, and we have to have political commitment in order to address the problem. And in addition to that, we have to increase the awareness of the community also, because political commitment alone will not help. That our society should also understand that this is a serious problem and has to do everything it can. This is, to be honest.
And we have to start now, right? Yeah.
We're late actually, so we have to start right now, and it's doable if there is commitment from the leadership, political commitment, and also commitment from our society.
At your presentation over here, you said Portugal chose the right direction. Do you think, honestly, that Portugal is prepared to launch this plan?
It is. First of all, you have NHS, the National Health System, or what you call SNS. And this is in your constitution, providing health for all, which is very important. And as you know, this is a constitution from 1979. And this is very important. Few countries have their commitment in their constitution as health for all. So that's very important. But now, even within the NHS, the government is saying we have to strengthen the primary health care. We have to focus on health promotion and disease prevention. And we have to increase awareness of our communities of the risk factors, like the smoking, the lack of activity, how these are linked to the increase or the epidemics of the non-communicable diseases. And with our community, let's try to fight the non-communicable diseases. So this is what I said, the right direction. And I can put it the other way. During our meeting with the Minister of Health, during the presentation, he told us that there is a shift now, a major shift, from hospital-based to primary health care, where there could be a lot of focus on health promotion and disease prevention, especially to focus non-communicable diseases in a better way. And I was really happy to hear that. And that's why, by the way, I say Portugal is ready for that. But not only that, I visited a primary health care called Basha. And I met very motivated young doctors. And they prescribe physical activity to their patients. And this is very important.
We're changing the world, yeah.
Of course, that's very important because this will really help people to get into the habit of moving, and it's already in your primary health care. And I even had a chance with walk with a doc, the program that you have here, and the patients or communities move with their walk with their doctors while discussing about their health, but also working together to promote physical activity.
Thank
I
you.
say Portugal is ready.
It's ready. Portugal is ready. It's nice to know. Thank you very much. It was a pleasure to meet you.
Obrigado.
Thank you.
Thank you.